Good evening. Welcome to this evening's regular board meeting. The time is 6 o'clock and I call this meeting to order. If we can please stand for the pledge and a moment of silence. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We may be seated. Did we have anybody sign up for open forum after all? Okay, no one signed up for open forum. So now we're going to go ahead and proceed to the superintendent's report. Item number 1, district highlights. Mrs. Castañeda, do you want to go ahead and share that?
Yes, good evening, board members. This evening, we do have a few highlights for you. Football is about to kick off, as you know, and our Benny LaPrade football stadium is getting a complete facelift. We put a little video together for you to show how the project is coming along. If you'd like to please take a look.
We noticed the last couple of years that our turf and our field have been deteriorating. So after doing so much research and calling some experts come look at it, noticed it was probably time to revamp it. We needed a new track. The track was crumbling in certain areas. We had some holes in it. And our turf had already been about 10 to 12 years in which we've had it. And we didn't want to have these safety concerns as years are going to be going by, because as time goes on, the turf compresses, gets really hard. As you can see, it lies just on bedrock. So with the wear and tear, it gets harder and harder. We're getting a new turf, which is a new artificial turf field. Turf, as a matter of fact, I didn't even know this, but basically it's made in Germany. So coming on a boat, goes to Georgia. At Georgia, they basically cut it out like a puzzle. It'll be shipped over here. It gets here August the 9th, and August the 10th will start to actually get out like the actual turf that's going on there. We're getting a new track. I know I've already been asked by certain districts if you'd be willing to host a district track meet, because this track will be state-of-the-art track. I don't think there's maybe like 1 or 2 of this type of track. It's a composite track. It's a very, very, very fast track, and you're getting a new scoreboard. The screen is going to be state-of-the-art screen. It's the same type of screen you see in McCown. It's almost like 2.5 times bigger than what we had. It's completely digitized, so it's again state-of-the-art. So it opens a lot of doors for the community and our kids to showcase what they have. I know they look at the stadium, they think it's more maybe a football or athletics, but this is for everybody. We're talking about fine arts, we're not talking about pigskin, we're talking about anything that happens at a stadium. So we're really excited. We're really excited for the kids in Donna. I want to thank the school board and everybody that made this possible. It was much needed. And every day that you can see it's finally taking shape. We're getting to the very end. It should be completed, at least the turf part and the track part, probably by the end of August, ready for the first game between Donna and Donna North.
Okay. So I want to pause. That is the highlight as far as our football stadium. The next highlight, do you all have any questions on that? No? Okay, we're going to go ahead and go on to our next highlight, which is our playground. If you recall, at the last board meeting, we showed you phases of one of our elementary playground projects. Today, we're excited to show you phase 2, which is the canopy installation phase. We have a brief slideshow highlighting canopies that have gone up at Adame, Munoz, Garza, and Salazar. Okay, we're excited to see these canopies coming up at our district, across our elementaries. The next and final phase will be to install the new surface. We're hoping to have everything completed by the start of the new year. The next district highlight that we have is our Fill the Bus campaign that took place this past weekend under Donna Walmart. And we have some pictures to show you there.
Mrs. Castañeda, I've got a question, I'm sorry. Back to
Yes,
the playground equipment. I know that the pea gravel was there prior to. So what are we going to put as a floor? I know the pea gravel is going out, correct?
Yes, that is correct. I don't know if Mr. Solis is on the call.
Is it going to be like turf? Are they going to put a little turf or
It's my understanding, yes, because they're not going to have that pea gravel anymore on the playgrounds.
I'm just curious because obviously that's something that kids fall and what have you. So as long as they are not going to be getting bruised or scratched when it comes to that, which was one of the things that was happening with the pea gravel. But that's one. And then question two may not be relevant to this, but it will eventually. I know that this 21-22 school year in the budget, we also had approved to get the 4-lane tracks for the elementaries. I'm hoping that someone's in coordination with these campuses to have an idea of where it's going to be located by now, because obviously I'm seeing that the equipment is already going in, and we had mentioned prior to that we want those tracks to be 400-meter official lane tracks, the four laners. So that'll be forthcoming, but of course it'll be somewhere in the playgrounds. Okay, so that was just an FYI, but once you find out about the actual playground, it'd be good to know. Just
Yes, sir. We'll
thank
get
you.
that.
Thank you.
I have a quick question, Steve.
Yes, sir.
Sorry about that. I had to step out. The stadium scoreboard, was it shown?
Yes, sir. The stadium scoreboard is already lit up. It's not completed, but they've already got it up and running.
Okay, and on the canopies, my fence in my house was blown down by the wind. How strong are these canopies? Did somebody test them for that? Or, because I mean, the wind is pretty strong.
They're supposed to be very sturdy and high quality, sir, but you know, I can certainly get some more information for you.
I
I
think
guess
those
a
are-
hurricane would be,
Yeah, I think those, Mr. Valdez, it's kind of like the latest thing that people are doing instead of those the tin roofs and what have you. I know that a lot of these new businesses are going with that, and they've sustained, if it's the same manufacturer that they use, they've sustained strong winds. So hopefully that'll be the same material.
So were the Eiffel towers, the Wi-Fi towers.
Oh,
You know?
they look really nice when you're under them though, right? The canopies are like, they look different when you're looking at them from afar, but right now when they showed the bottom, they look really nice. I like them.
They look real nice, yes, ma'am.
The kiddos are going to really enjoy that.
Exactly.
So thank you to you and to all your support. So we're getting these placed at all our campuses, elementary campuses. Next, we have the Fill the Bus campaign. Like I mentioned, it's something that took place over the weekend. We had a really good turnout. We had a lot of volunteers. We had a lot of support. And there are some pictures that I would like to share. We had over 8,000 items, including backpacks, notebooks, paper, pencils, and other school supplies that were donated. We also received some cash contributions, including a $250 check from State Representative Armando Martinez. So we are very thankful to our Donna ISD community and surrounding communities for coming out to fill the bus. Our elementary campuses have already received their portion of the donations, and secondaries should be receiving those supplies in the next few days. The next item that we have as our district highlight is going to be our teacher incentive allotment program. As we told you previously, the district received TA approval to pilot its teacher incentive allotment program at M. Rivas School of the Arts and 3D Academy. The program creates a path for highly effective teachers for approved teacher incentive allotment districts to receive anywhere from $3,000 to $32,000 a year on top of their annual salary. 4 teachers were recipients this past year. Now we're happy to announce that TA has approved the program to be implemented district-wide, which means that teachers, all our campuses, have the opportunity to qualify for additional funding. Dr. Sorolla is with us on the call. Dr. Sorolla, if you want to share a few words on the teacher incentive allotment?
Yes, ma'am, most definitely. So we're very proud of the fact that we got notice this week of our provisional approval of our cohort D application, which now expands our teacher incentive allotment involvement to all 23 campuses in the district. And so all teachers in the district, we're talking like now, nearly 1,100 teachers who completed T-test evaluation and they complete a student learning objective. These are the key evaluation metrics. These teachers will qualify for the chance to be put forth for designation as either recognized, exemplary, or master teachers. And these designations, they translate into strategic compensation for the teachers. So it's on top of their standard salary. And as Ms. Castañeda indicated a moment ago, so far 4 of our teachers have earned recognized designation status at 3D and Rivas, and that number should be expanding quickly in the future. The teacher designations are good for 5 years, and it's important that we continue to demonstrate a solid and valid system of educator designation to earn long-term approval after this coming year. One other thing I want to indicate is that the district has been involved with Region 18, the service center, specifically is with regard to data management. We have to manage quite a bit of data with regard to student performance and observations. This is part of Project Rise. And we have an opportunity. Region 18 has approached us about partnering with them on a grant opportunity. This is on top of teacher incentive allotment, and that's called the Teacher and School Leader Incentive Grant. And this will provide funding for a data management system, professional development for evaluators on integrated reliability, and incentive pay for the evaluators who are principals and assistant principals. So we look forward to bringing you guys more good news with regard to that grant opportunity, as well as teacher incentive allotment.
Thank you, Dr. Sorolla.
That's it.
Well, one more, and it's very exciting, more positive news. The preliminary rating for the 2020-21 School Financial Integrity Rating System, we've learned that TA has released them. And once again, we're happy to announce we have received the highest financial integrity rating for the way our business office has managed, distributed, and reported its financial resources for the prior year. We'd like to commend our business office for their hard work in making sure we continue to maintain good financial standing.
Thank you, Ms. Castañeda. Moving on to item number 2, August LSG Monitoring Report, Goal 2, GPM 2.1, 2.2, 2.3, Superintendent Evaluation of Goal 2 and Next Steps, Superintendent Constraint 2, CPM 2.1. Ms. Castañeda?
We have Mr. Rana who will be presenting on this item.
Good afternoon, Ms. Castañeda and respected board members. It's my honor and my pleasure to present the monitoring report, board goal number 2. As you know, the board goal number 2 is regarding the reading. These are our goal, percentage of 3rd grade students that meet or exceed grade level of proficiency star reading will increase from 32% to 41% by 2025. The same way 2nd grade will go from 40% to 70% by 2025. 1st grade move from 31% to 70% by 2025. Kindergarten 69% to 80% by 2025. So these are our goal for the next 3 years and 4 years. This is the same thing in the table form, which is the 3rd grade students that meet or exceed grade level proficiencies. As you see on the top, that's our board goal, goal number 2, which is the 3rd grade. This year, our goal sustaining what we had in 2018-19, 32% to 32%. And our next year goal is 34%. And the respective, the GPM progress measure for second grade, first grade, and kindergarten. This year it was a 40%, 31, 30, 69%. Next year will be this one, and this was the last year. So moving on to the special population. This is a third grade, solely third grade. The special population, we have all students, 32%. Goal is 32%, and next year will be 32%. And the rest of the special population, our Hispanic, EcoDisc, and ELL students and special education students. This is our the report, the results. It's not like promising. It's not like something like we wanting or we were expecting. But as you know that about 40%, 38% of our students, they did not take the STAR test, and so on and so forth. So let's take a look. Q3, which was our benchmark, which was 25% all students, and so on and so forth. Q2, which is a 9%, and our goal was 32%. So our STAR score, the student they took about 72% of our students they took the STAR test, and 38% they did not take the STAR test. This is a situation at the meets level. So we have a student like their score in 40s and 50s, but with approaches. Here we are presenting only meets level. So the meets level, as you know, that we have not seen our students in full-fledged the last year and a half. So it's very difficult for the students. The teacher did their phenomenal job, but it's very hard to control and then get the result what we were expecting. So our all students 9%, Hispanic 9%, EcoDisc 8%, English language learners 7%, and special education, those students, they were inclusion students, not the students life skill and other students. It's the only students we included. They are about 37 students, inclusion students. They did go to approaches, but did not go to meets level, the meets level, which was our goal. This is our second grade. Our goal this year was 40%, and the next year will be 48%, all students, and so on and so forth. This is second grade. So with a special population with Hispanic, EcoDisc, and ELL, and special education, that is a mixed result. The Q3 was 43%. Q4 is 37%. Our goal was 40%. We did not reach to the goal, but we were very close. As you know, the student, they have gained at the end of the Q4 report is always students at grade level, like which was in case of second grade, the student should be at 2.9 reading level. So the Q3 report was 2.6. So we were increasing the student as we were Q3, Q4. Student may have progress from 2.6 to 2.7, 2.8, but they did not reach to 2.9 at the quarter level, but student, they did improve. So our goal was 37%. Goal was 40%. We ended up 37% for all students. Hispanic 37%, EcoDisc 36%, and 27% ELL, and 19%, which is we surpassed our goal. Our goal was 12%, but we in special education we surpassed our second grade goal. But the rest of the goal you could see they were very close. We are not that far. As I said, Q3 was 2.6 reading level, but Q4 is 2.9, which is higher than we did not meet what we expected. First grade students reading level, our goal was going 30 in 5 years, 31% to 70%. Our goal was 31%, 32% with the Hispanic, and so on and so forth. Where we are in terms of first grade, you see like our goal was 31%. We already have met the goal 33%. 32%, we met the goal 33%. 26%, we met the goal 32%, 30%, 29% very close, and 12% and 22%. So in first grade, we had we met the goal, not met the goal, also surpass, except our English language learner. And that's again, quarter 3 was 1.6 grade level. In quarter 4, our goal was 1.9, which is like, if you look at the reading level every month, we go 1 point increase from previous month to this month. So first grade, they met the goal. Kindergarten students, our goal was 69% to 80% in 5 years. You see our goal 69%, 18, 19, 69%. Our next year goal will be 72%, and then the rest of the population scored by sub-pop is down there. So this is, we did not meet in kindergarten the goal we were expecting. 69% was our goal, 41%. As I said, students may have improved, but they did not reach to 0.9. It's called K.9. They did not reach to that, the threshold we had. And 69, 41%, 69, 39%, 68, 32%, and 39, 28%, which was closer than the other grade level. As you know, the kindergarten student, they need a lot of one-on-one instruction, and then face-to-face, the teacher can give them immediate feedback and then make sure they are reading at grade level. We have a lot of work to do, as we did not meet the kindergarten what we were expecting. Due to COVID-19 pandemic, there was no goal presentation for the quarter 4 in 2020. So therefore, there is no comparison available. So these are the things, what's the next step we are doing. All kindergarten teachers will be certified this in few weeks. They will be HB3 Reading Academies certified. So the teacher, they went through all year long reading academies. They learned from the experts and the consultant through Region 1. So with the knowledge the teacher they gain, I'm very positive, I'm very positive that they are going to implement in the classroom, and the students will benefit definitely. This year, we are going to train our first and second grade teacher reading academy through the HB3 from Texas Education Agency via Region 1, and hopefully by kindergarten, first and second grade, this is where our big load is. We want to make sure the students are reading at grade level with the help and then more knowledge about science of reading. I hope that we will create a pipeline where our students, they are reading at grade level. So our early department continue training teachers in guided reading. That's our goal, is more and more guidance, more training. And then we are employing the systematic phonics program through HMH. We have updated timeline based on our, we saw the reading level and the students struggle throughout the year. So we have adjusted our timeline, and Google resources and blended learning, which will be one of the initiative as I shared in the learning loss plan. So we are bringing the iStation back for both English and Spanish. Before we had the Galileo Imagine Learning, they were providing us partial, just the English portion. So we, in sake of simplicity in our district, we are going to just concentrate on the iStation, both English and Spanish. And then the recommendation has been made to the principal, so we can add guided reading in their built-in master schedule. And these are the couple of steps we are going to follow in order to go to the school, the expectation that board is expecting us to perform. Evidence, English reading provided by Imagine Learning, Galileo, as a lot of teachers can assess that this was a very challenging test. But our first grade students, they demonstrate the knowledge they had. So the Spanish was EOY 3 data export from the iStation, the Spanish data, and STAT data is from our score. 72% students, they took the STAR test. Student recognitions, I see a lot of good, even the score is low, but we see a lot of positivity among campuses. So congratulations to all second grade students and teachers who have already exceeded their board target for their first grade and second grade. Salazar Elementary, Guzman Elementary, and Stanky Elementary, they surpassed the board goal. Is there any question I can entertain or answer? If not, back to Ms. Rebecca Castaneda.
Mr. Rana, I've got a question.
Yes, sir.
I know you're going over this data with regard to the grade levels, but
Yes, sir.
at what point are you going to be presenting these things? How are Spanish kids are doing because of the bilingual programs? You got your kinder, your first and your second.
Yes, sir.
That's where they should be obviously being taught in their first language.
Yes,
And
sir.
I noticed that there toward the tail end, you mentioned something about the Spanish. How are we doing with the simultaneous biliteracy program? And at what point are you really going to be bringing this data with the Spanish speaking students that are being taught in K first and second? Because obviously, you know that when they start testing, they can actually test in Spanish, third, fourth, and fifth. So how do we know the difference between all that data you just presented in reading? It's just one number. How do we know who are the ones that are the Spanish learners for right now because of their bilingual and the English reading?
Yes, sir. The biliteracy students, we test in both language, English and Spanish.
My question is this, Mr. Rana. How do we know the numbers? I don't need to see all the details. I just would like to see how many numbers do we have in each campus that are Spanish speaking or being taught in that manner. Your kinder, your first, and your second. Because eventually those kids, when they get to middle school,
Definitely.
it's going to be English.
Yes, sir.
I think, Mr. Rana, I'm going to add to what Mr. Castillo said. I think the board has already, we love looking at our goals and seeing where we are, measuring our progress every time that we have a board meeting. But I think this board is a little bit beyond that. I think what we want to do is we want to add to this presentation, we want to add more. For example, we want some type of data analysis that has already been done and bring it to the board, identifying, okay, based on the data that we're looking at, these are the campuses that are struggling, these are the ones that are on target, these are maybe the special populations that are struggling, the ELLs in comparison to others, the special ed. We want more specific, and we don't want pages and pages and pages. I'm thinking maybe like a one-pager data analysis. But most importantly, I think what we want to do, because we know that this will help improve our scores, we want to know more how are all these things that you said on the superintendent's evaluation, how are they being implemented at each campus? And what are the monitoring systems that we have in place? For example, what exactly are principals doing to make sure that guided reading is part of the schedule? Because I think that's one of the items you mentioned.
Yeah.
Guided reading as part of the daily schedule every day. What are principals doing to make sure that's monitored and that is truly happening and that it's being done exactly as it should be? And what is central office doing to assist the principals in monitoring that implementation? That's what we want to know. We want to go deeper into the behind the scenes.
Definitely, we want to be a data driven. Do
That's
you see my screen, the new screen?
Yes, sir.
So this data is by campus. As you see, the district, this is by grade level, second grade, 2.2, 2.3. So this is a goal number 2. Like a district, we have a 60 student, they met in third grade, 665 students, they took the test. And then we have a Hispanic, Equidisc, and English language learner. This test is both English and Spanish. I know.
Okay, Mr. Rana,
I know.
Mr. Rana,
Yes.
Mr. Rana, I know you're giving us, again, just information. Use Adame as an example, the campus. If this is this second grade data?
It's a third grade.
Third grade. Third grade.
Okay, third grade data. All right, so then go all the way to the far right where it says English learner. Is it correct that 6 out of 49, met the standard or what? But you have 49 Spanish speaking students there, right?
No, this is a both English and Spanish. They took the STAR test.
But I want, I'd like to see Spanish.
Separate, English and
because-
Spanish. separate.
Right, because remember, I've always told you, we have at least 80% minimum bilingual in the elementaries. Some of them are as high as 95% bilingual.
Mhm.
So it behooves us to really be zooming in and see what they're doing, because obviously that is their strength right now. Their first language is Spanish.
Yes,
And
sir.
we need to capitalize on that.
Yes, sir.
And when they get to middle school, they're going to be capitalizing in both languages. Hopefully that's the goal.
Mhm.
And obviously when they get to high school, the EOC is all going to be in English, obviously, like in middle school.
Definitely, sir.
So-
We
Yes.
will,
So based on what we talked about, I mean, I don't want to be saying charts because it's going to be taking too much time, but certainly concur with Ms. Valdez mentioned. We need to know how these populations are doing, and now we can see what is really happening, the details behind the scenes to be left to you all at the campus and the administration.
definitely.
And Ms. Castañeda, and I don't know, I mean, I guess maybe what we're trying to see is, I know this data is given to us, but we're trying to go deeper, like the guided reading is critical in order for us to meet our guided reading or reading goal. We know that's important, so I don't know if maybe if there's anybody in the district that could do this, or if it's a new position that will need to be created. If there's someone at the district level that could analyze all these data for all these different things, like the guided reading, I think iStation, I don't know what it is, I saw several of them, that can give us that information to the board and say, these are the campuses that are struggling, these are not, this is the support systems that we have in place. Someone that can analyze all that data, and not like pages and pages, but maybe like a small summary at every board meeting. I think that would help tremendously. I don't know if there's an expert already in the district that could do that, or if that's a new position that will need to be looked at. I mean, I don't know, that's up to you, but I think the board is wanting more information than what we're getting.
Okay, yes, ma'am, we can certainly look into that, and I will get together with Mr. Rana and Dr. Acevedo so that we can see what else we can do, and we will bring that to you at the next meeting.
Any other questions? So, Mr. Castillo, do you accept report? Mr. Colonel? Mr. De Los Rios, are you with us?
Yes, I accept.
Okay, Mr. Valdez? Mrs. Watts? Mr. Reina? And I also accept. Moving on to item number 3, discussion and possible action to approve official delegate and alternate for the TASB Delegate Assembly.
Yes, ma'am, you all have that information right in front of you. This is just to delegate, have assign someone for the 2021 TASB Delegate Assembly.
It's basically just to approve what was on the,
Yes,
do I have a,
I believe you have to nominate an individual.
oh,
Nothing's come up on the screen. Was something supposed to come up?
the list of the delegates are?
So there's who will be attending the TASB Delegate Assembly September 25th?
So it's got to be somebody from here?
Yes, whatever board.
I nominate Mr. Valdez as the secretary.
I second.
Well,
So, Mr. Castillo, you vote in favor?
oh, yes.
Mr. Colonel? David, you voted, right?
Yeah, I voted in favor, second.
And Mr. Reina and Ms. Watts also? And me too. Congratulations, Mr. Valdez. You accept, right? Yes. Yay. All right. Moving on. to the-
We need an alternate as well.
Oh, an alternate. Okay.
I nominate Fernando Castillo as the alternate.
I agree with that one. Mr. Colonel, you vote in favor? Okay, Mr. Valdez? Mrs. Watts? In favor, Mr. Reina? Also vote in favor, motion carries. Moving on to item number 4, discussion and possible action to approve health insurance stop loss PBM recommendations for 2021, 2022 plan. There's a presentation, right, Ms. Castañeda, from the,
Yes, ma'am. Dr. Sorolla, if you would like to introduce that.
Yes, thank you. Good evening. So during this particular action item, we have a presentation that's going to be facilitated by Mr. Rivera, our benefits supervisor, as well as our health insurance and our workers' compensation consultant, USI Southwest. Mr. Rivera, if you want to go ahead and introduce the consultants and begin the presentation.
Good evening, Mrs. Castañeda, Dr. Valdez, and members of the board.
In our last board meeting, our new insurance consultant was approved to come on board and assist us with managing and providing us sound recommendations for our health insurance. This evening, they will be making an introduction and providing the recommendation for the upcoming plan year 21-2022. I now turn over the screen to Steve Karamsuk and Trey Smith.
Awesome. Let's see. There we go.
I think you all need to share your screen.
Yeah, we're trying to get it. Is it showing?
No, just if you go to the bottom where it says share screen, share the presentation and share, and it should come up.
Share screen.
Click on that. And share.
There it goes.
Okay, we can see it now.
Perfect.
Awesome. Thank you all very much. All right, you got it? We good?
Yes.
All right. Thank you for having us. My name is Trey Smith. I'm with USI, Steve Karamsuk. We are the new consulting team working with Donna ISD, and we are going to walk you through really today's agenda will consist of a financial summary. We'll walk you through the renewal plan and contribution scenarios for the upcoming plan year, budget recommendations that we have made in conjunction with the risk department as well. And then the option to renew the stop loss with Blue Cross Blue Shield for the 21-22 plan year. We're going to walk you through next steps and then plan initiatives as well, things that we can look forward to in the future. Just to give you some background on USI, we're a large national consulting firm with offices in 50 of the largest metro areas in the country. Steve and I are based here in San Antonio. We have over 40 employees at office here in San Antonio, and we have extensive experience in the self-funded market as well as experience in the public entity market. So I personally have done a lot of work with cities and counties, municipalities, and a handful of school districts in the Rio Grande Valley as well throughout my career. So just to kind of walk through the key findings in our financial summary, we were brought on board as the new consultant effective August 1st, 2021. And we've been working fast and furiously on the information that you see here today. And then we will open it up to questions as well, throughout our presentation. So if you look at what we found with the current health plan, and we're going to speak really specific to the health plan contract for the meeting today. But when you look at the 2021 plan year, the budget was set at expected cost, not maximum cost. That's important to point out because that will be key as we walk through some of these numbers throughout the presentation. In terms of the claims experience, for the last we have is basically 10 months of data. So we have September through the end of June for this plan year. There are 34 large claimants on the plan that account for over $50,000 for each one of those large claimants. And they accounted for about 5.3 million of the total 10.1 million that was spent on medical claims just in the last 10 months. When you look at the budget, so currently the budget shortfall is running about $380,000 a month. Meaning the contributions that we're making to the plan are not enough to cover the claims spend that we have, at least for the last 10 months. Now, we've got some recommendations to make on what we do going forward, including, the new plan that starts September 1st, 2021 and carries through the end of August, 2022. If you look at the current contributions, I'm over on the right-hand side of the screen now. So for the last 10 months, this is just a summary of when we talk about setting a budget, we're talking about the contributions that the district is making on behalf of the employees, and then the contributions that the employees are making to the plan. So that's essentially our budget that we're working with. And we're talking both medical claims and pharmacy claims. So medical cost and pharmacy cost all kind of lumped together there. But the contributions being made by the school district and the employees is about 13.1 million. And when you look at the spend over the last 10 months, it's almost 17 million. So we've got a budget deficit there of about 3.8 million currently. When you look at recommendations that we're going to review, the Blue Cross Blue Shield of Texas fees and stop loss renewal were essentially flat in terms of cost. We'll dive a little bit deeper into that, but that's for the upcoming year. So I'm taking a look at what's happened the last 10 months, and then we're taking a look at what the renewal is going to look like for the following plan year starting September 1st. We're going to be discussing 2 possible health plans or network options for the 2021 and 2022 plan year. Currently, there are EPO plans that are in place with Blue Cross. And the insurance committee has recommendations to move to 2 HMO plans, and we'll dive a little bit deeper into what that looks like. The current pharmacy contract, when you see PBM there, that's the pharmacy benefit manager. The current pharmacy contract in place with ESI was put in place, prior to USI coming on board as the consultant. And that part of that contract requires a 60-day termination notice. So as we got involved here just in the last couple of weeks, we've explored other pharmacy contract options, but it looks like we are likely to run out of time given the 60-day termination notice that's in place with ESI, but we'll walk you through what options may be available for the pharmacy plan. Okay, moving forward, if you look on the top right-hand side, the stop loss premium is increasing slightly from 2.372 million up to 2.5 for the 2021-22 plan year. And this is essentially the Blue Cross Blue Shield of Texas renewal. We did want to point out, we talked earlier about how the administrative fees and the stop loss is almost flat, but we've highlighted here some key findings. So the net administration fee that Blue Cross is charging to administer claims came down slightly for next year, about 8.4%. The individual stop loss contract at 300,000 went up about 5%. And when you take into account the total fixed cost for the plan, it's a slight, 0.6% increase from Blue Cross there. That last highlighted point down there with the total projected cost per employee, that is reflecting a 25.4% increase. That is essentially the cost of claims. So we've had a tough claim year the last 10 months. And Blue Cross is projecting that number will go up, assuming utilization stays the same, large claimants stay the same, that it would increase about 25.4%. So claim spend going up, projecting out what next year might look like. You'll notice in the bottom right-hand corner, the needed annual budget there. That's what the budget should be at. If we were to run at a similar year that we ran this year. So if next year we were going to run just like we did this year, we would need essentially $20+ million to cover claim spend for the entire plan. Okay, now we're going to walk through kind of the 3 scenarios that have been discussed by the insurance committee, and they've made recommendations on these. So this option that you see in front of you is taking into account just renewing on the current plans that are in place. So there are 2 EPO plans that are currently in place with Blue Cross. In this scenario, the talk is that the school district would then increase their contribution per employee from $505 a month to $550 a month to cover a portion of the added claim cost going into next year. And if you look at a percentage breakdown in the top right-hand corner of the graph, you'll see employee rate action of 29.4% and the district rate action of 8.9%. That's essentially the cost needed on the contributions or to the budget to cover claims. So this scenario that we're walking through right here, these are the monthly contributions for each of the plans for the employees. If we were to do nothing but renew on the current plans as is. Any questions on that? Okay. So that's kind of option 1, renewing as is. The only change would be the district increasing their contribution to the employees by $45 a month per employee.
I think that's what we had said, yeah.
Okay, option 2, this was placed in front of the insurance committee as well. This is renewing with Blue Cross, but putting in place, getting rid of the EPO plans and putting in place 2 HMO plans. Now, keep in mind an HMO plan and the way it's constructed here in this option is that all care is driven through a primary care physician. You can see that there's a reduced cost here. So there's some cost savings to the plan moving from the EPO model to the HMO model. And that's taken into account when you look at the contributions to the plan. So the employee rate action of 13.4% increase over current and the district 8.9%. And each one of these scenarios that we're walking through, it's taking into account the district contributing, the district contribution going from 505 per employee to 550 per employee for the following plan year. So that is basically taking into account very similar plan design to what we have now, but moving from an EPO plan to an HMO plan, 2 HMO plans. So we're shifting the network from an EPO to an HMO, but keeping the individual line item benefits consistent with where they are today. Any questions on that?
Yeah, just for the benefit so that the board fully understands, can you just briefly, just take a minute to explain the difference between an EPO and an HMO? Just so that we're clear on that.
Yeah, very good question. So an EPO, the best way to describe it, it operates just like a PPO plan. So a larger PPO network, just the out-of-network benefit is removed. So you have to go to an in-network provider with Blue Cross. There's no out-of-network benefit being paid. And Blue Cross's EPO network, it's the same as their PPO network. There's just no out-of-network benefit. And in an HMO environment, all care has to be directed outside of emergency, but all care has to be directed through a primary care physician. So one of the big changes this year, if the district were to move to an HMO platform, is that each employee would need to designate a primary care physician. And there's enrollment communication that will be done to ensure that employees know exactly what providers are in the HMO network so that they can select a primary care physician that's in the network. Does that help?
Yes, thank you.
You bet. All right, and then the third scenario here, and this was, so all of these options were presented to the insurance committee, and this was the insurance committee's overwhelming recommendation. So this third option is moving to HMO plans lowering the deductibles. So in the prior scenario, it was basically a similar plan design to the EPO. This is a different plan design. So it's the HMO network, but we're lowering deductibles $500 and lowering copays by $10. So a little bit more benefit to the employees and the dependents there in lowering the deductible and lowering some of those copays. But this is moving to an HMO plan. You will see that the employee rate action there, it's just about a 16% increase total to the employees. And, you know, that 8.9% increase to the district, which is taking into account that extra $45 per employee per month that the district would contribute. So this, this recommendation takes into account another strategy that we've talked about as well, which is wellness initiatives that we'll get into in the following slide. But one of the things that you want to take a look at when trying to figure out how you lower overall cost within a health plan is making sure that your members are engaged with a primary care physician. That's really where it starts. So you can mitigate future risk by making sure that those employees and those dependents who may not be engaged in the healthcare system now become engaged as they have to interact with a primary care physician. And you can, you know, if you're meeting regularly with a primary care physician, you can stave off some of those high dollar claimants down the road that could be, you know, some of those sleeping giants that we find, you know, somebody who maybe hasn't seen a physician in a number of years and has, you know, undiagnosed high blood pressure or even diabetes, can encounter all kinds of larger claims and cardiac conditions as they're not seeing a primary care physician on a regular basis. So I think this recommendation from the insurance committee is a strong one when you look at trying to figure out how to lower overall cost. The idea is that through the HMO plan, they've got to engage with a primary care physician. And at the same time, that engagement is, you know, we hope in turn will lower, you know, some of those big ticket items or some of those sleeping giant large claims that could be out there. So just to summarize, this was the insurance committee's recommendation, moving to HMO plans, lowering deductibles by $500 and copays by $10. Any questions on that?
Yes, I've got a question regarding that. So you're telling us that the insurance committee is what, this is the plan that they're recommending. How big was the insurance committee? Was it still the initial size and the demographics were pretty even with regard to our professionals and auxiliary?
So that's a good question. We were not involved and we were not the consultant at the time, the last time the insurance committee met.
We can chime in, Mr. Rivera. I know the committee had about, was it 35 members, Mr. Rivera?
We had about 35 members in the committee. They were from representing all campuses and some of the departments as well. So we made sure that they were able to represent a good size of the population. Another initiative that we took was we sent out a district-wide survey on what employees wanted to see on the health insurance or what is it that they liked or that they didn't like. So we did take some of those recommendations in mind as well, considering the options that we had in hand.
I want to say we had at least five meetings, Mr. Rivera. I think close to about 10 hours of discussion time.
Yes.
Mr. Rivera, how many surveys did you get back?
We had about 400, I believe.
Okay, you got about 400.
Responses, yes.
Okay, that's a good return.
Going back to my initial question of the committee members, so we've got about 35 and
sample.
Right, and it was, again, I think the last concern that I had brought up was with regard to our auxiliary staff, because obviously the professionals, they're pretty savvy about reading materials and so forth, but sometimes our auxiliary may not be able to comprehend the English language. So I was hoping that you can tell us that you did explain it in a face-to-face or showing examples of that, because by all means, I am not in any way the expert in insurance at all. But I do know one thing, which I want to see if you can clarify it for me. Anytime you want to lower a price of something, for insurance, you want a high deductible. Okay, so in this case, and I'm kind of comparing home insurance because I'm going through that process right now. When you lower your deductible, usually your rate's going to be much. I mean, where are they saving? If you lower the deductible, I think you're going to be paying more for the premium. Am I not correct?
Correct, yes. And the previous slide that was shown, it does have a slightly lower rate than this one. But we did take into consideration those suggestions or those recommendations that they wanted to see at least a little bit of savings on the copays and the deductibles. So, for example, the employee only went up from $28.35 to $29, and that allowed it for the deductibles to be lower than the copays.
Yeah, and also that's a very good point, Mr. Rivera, because I'm looking at the employee only, we have 1,405 enrollment. So 66% of our district employees would only see a $4 increase.
Correct.
One thing we discussed with the committee, and Mr. Rivera, you can chime in on this, but we discussed when you compare the current structure of EPO versus the HMO, and you compare the networks and how much of an overlap, how much of a consistency. I think we saw that it was 98%, 99% match.
Also a 98% match. So there should be very little to none disruptions on the healthcare provided to our employees.
But I guess I'm kind of agreeing with Mr. Castillo. I wish we could see more of the breakdown maybe of the committees, right, Mr. Castillo? Like how many bus drivers, custodial, maintenance, food service, paras were part of the committee? Do you have that information, Mr. Rivera? We just want to make sure that all district employees had input.
Yes, I can provide it to you.
Okay, and then obviously, you answered my question that because when your deductible goes down, which is what we want for our employees, then the cost to minimum, if anything, up. You mentioned something about wellness. You're going to have a slide presentation regarding wellness coming up. But that's one of my biggest things that I've always wanted to see is to have something ongoing in terms of all of our employees or staff, wellness programs.
Yeah, absolutely. We'll fast forward a little bit here. One thing before we get to the wellness initiative piece, this is a breakdown of what the recommended HMO plan designs would look like. So you can see in the current plan designs that you have now in that EPO model, the medium plan has a $5,000 deductible. The high plan has a $3,000 deductible. Those are coming down, and then the copays are coming down as well. And just to answer the question on costs, so Mr. Castillo, your thought on deductibles going down, price should go up. That's a very good observation. What I would say here is that we are getting the benefit of a more favorable contract with the providers in the HMO network that are saving money as well. And so it's a more favorable contract that's lowering claim spend there just by moving to an HMO network from the current EPO network.
Thank you.
Well, I do have a question though, regarding to the coverage. We covered all the expenditures we have for the media plans and HMO plans, because I gather these are very similar to the plans we presented previously by the last consultants we had. Now, giving the data that you have, I'm assuming you also considering the cost, the rise of costs we have for the year and what it's impacting. So in those costs, an example, you spoke about this earlier, that affect our pay and what we pay as a district, obviously, on behalf of the employee, knowing that we have high items out there for the year, because it was an unusual year. We had a COVID-19 year, and we'll continue to have that throughout this following year. And obviously, with the new COVID-19 that's been indicated or being infected by it throughout our cities, how is that going to impact? Again, it goes back to increase, because you just talked about dollar figures. So those dollar figures going up to 20,000 or 20 million, I'm sorry, dollars. It's quite hefty for a district to continue to pay for the next year or 2 years. Can you cover a little bit about that, please?
No, it's a good question. So when you look at the large claim report that we have from Blue Cross, of the 34 large claimants, I believe there are 12 of those that were COVID related. But there are 4 large claimants on the plan, 4 individuals that have incurred more than $300,000 in claims just in the last 10 months. And when you look at the diagnoses represented in your large claim listing, a lot of these are folks that are managing multiple chronic conditions that ties into the wellness initiative that we'll talk about. So engaging people in the healthcare system earlier through the wellness program, through their primary care physician, will hopefully in turn stave off some of these larger claims that pop up with those individuals who aren't engaged in the health system until it's an emergency. So that's one way we hope to curb costs in the future. But I can tell you in our analysis and digging through the large claim information, it's not necessarily all related to COVID. It's a combination of the effect of COVID, but also a number of folks managing multiple chronic conditions that are costly. Any other questions there?
Thank you. I'll look forward to the other piece.
Gotcha. All right. So in terms of recommendations, we did mention earlier, the insurance committee recommended with a majority vote, moving to the Blue Cross HMO plans, lowering the deductibles by $500 and reducing copays by $10. In terms of how we manage this plan, we just stepped in, we're new. We have a ton of experience in this space, but it was, I would say it was difficult in the last couple of weeks as we put this information together, because we essentially built a lot of it from scratch. So the public entities that I've worked with and school districts that I've worked with in the past maintain a budget that is the district's. We, as the consultant in this scenario, obviously we will engage the district and keep up with that budget, but we think it's important that we come alongside the district and ensure that if the board down the road, let's say 3 months from now, 6 months from now, somebody within the organization, within the district, or a school board member has a question about where do we sit year to date on our budget, the finance department, the risk management department, all of you are going to have access to that on a regular basis. It's not going to be information that we keep. So Mr. Rivera was very nice and filled us in with just about as much information as he could possibly give us. And we actually built a budget from scratch in the last 2 weeks because it didn't exist outside of, simple debits and credits as to how the plan was managed before. And I think the prior consultant was the one who housed that budget. We will house the budget, but you will also house the budget too going forward. So that's one of our big recommendations moving forward. And then along with that, we're going to include the insurance committee in quarterly meetings to discuss the budget, what the financials look like, what trends look like on a regular basis, and then strategies to lower costs. So I mentioned the budget process, so we're going to create a different budget process for the district going forward that we work hand in hand with you on. One of the other recommendations is exploring changing the current pharmacy contract that's in place to create additional savings. The challenge that we have there is that we've simply run out of time, and there's a 60-day termination notice that's required of that. We've reached out to Blue Cross, obviously your current plan administrator, to get a pharmacy proposal from them. But we would love to have future discussions with you about what the possibility might look like of changing that contract. And we could do it mid-year, but we want to make sure we have discussions around that and set up the proper RFP process to see if that might be something that we do off renewal or in the middle of the plan year. Either way, worst case scenario, we can do a full RFP for the pharmacy contract prior to renewing next year, so that we have more options to entertain, savings and possibly other plan options as well. I mentioned the wellness initiative. So I think we're taking steps in the right direction. I mentioned earlier, we work with a number of employers who throw a lot of good money at bad wellness programs, and we talk them out of it. It's easy to throw money at a wellness program, but what we found through our actuaries and our population health management teams is that the most effective wellness programs start with engaging people in the healthcare system. Most of your large claimants, not all, but on average, most come from emergent activities or emergent situations that occur when somebody was not engaged in the healthcare system. So our wellness initiative that we would recommend, and it goes hand in hand with the possible move to an HMO plan, is getting folks engaged with a primary care physician so that they can get, their routine blood work done, their routine physicals done, to identify those challenges and issues that they might need to solve for, in the short term, instead of waiting to do that, in an emergent situation. We will also speak to the education and communication pieces of this. We will come alongside the district to ensure that employees are communicated on exactly how that program will work. How do you get engaged with a primary care physician? What is the role of a primary care physician? And then, what happens if I need to go see a specialist? How does that work? I do believe that Mr. Rivera had conversations with the current brokers of record who are handling the enrollment pieces and the enrollment communication that will be going out here starting in I think the next week, to ensure that there's communication around what it means to have a primary care physician, and making sure that each employee and their dependents has an assigned primary care physician by the end of this open enrollment going into next year. Okay, I'll stop and come up for air there. Any questions on those recommendations? And I've got a couple other pieces to add too.
Yeah, I do. On the explorer of changing the current pharmacy contract that is in place and to create additional savings, how would that be different from what savings we could have with the current provider, Blue Cross Blue Shield?
So I think it requires a full pharmacy analysis that has not been performed yet. What we do in that analysis is we take a look at the total utilization of the drugs that are being utilized on the plan, the formulary that is in place, and the cost of those drugs in the current arrangement. And is there a possibility to change that formulary, what drugs are within that formulary, and the cost of buying those drugs, to see if we can get, better deals out in the marketplace for those drugs. The other thing that I would recommend too is exploring where employees and dependents buy their, I say drugs, it sounds odd, but where they go get their prescriptions filled. There is a large retailer in the state of Texas that has changed their pharmacy model to where they're creating a more clinical approach to pharmacy. And I'll give you an example. They're creating programs within their facility in which they help members who are purchasing their scripts from them to better handle their or better manage their chronic conditions, creating wellness programs there, and creating dietary changes within that retail facility to come alongside that customer of theirs to make sure that they're treating their chronic conditions in the right way and that they're managing them in the right way. And that can all tie into a unique pharmacy program that can save significant dollars. So it's exploring other partnerships within the community that makes sense. And it's our job as your consultant to bring those options to you as a board and to the insurance committee to see if that, makes sense, down the road to move to a different pharmacy contract and the way we structure that. So obviously we didn't have time to go through a full RFP process, but I would highly recommend that we look at doing that either mid-year or definitely it will be part of the process, for the next plan year, for the 2022-23 plan year.
And what would be the cost for your wellness initiative, or is there a cost tied to that?
There is no cost tied to it. So it's just, the cost is time spent educating and communicating employees on the changes within the HMO plan and how they can best use their health plan on their own.
Colonel Perez, if I may add also, this wellness initiatives was a big item in our insurance committee meetings. So we will put a lot of emphasis on making this a priority for this upcoming year to educate our employees so that they can know how to best utilize the health insurance. Of course, doing your annual checkups, your lab works, taking care of all of that so that we can prevent future illnesses, so that we can identify them on time before it's too late.
No, I got it. I just make sure that, because, as you all well know, and this is nothing new, we can't force any employee to do any of those items. We can recommend and to wear blue, but don't do it. It's just non-solvable. That's step one. But communication obviously is important, and thank you for doing that. I think it's a good initiative, but again, having employees to go do what they need to do on a yearly or quarterly basis is very difficult. Because even I can get, for me, for example, and I'll give myself as an example, if I have time, I'll go maybe once a year to get my annual checkups. So I mean, when we're working on a daily basis and we have work, in our environment, it's very difficult for them to leave. Obviously, they can take leave, obviously, but even then, like I said, it's gonna be tough. But I do applaud you for the wellness initiative that you guys are trying to do. Thank you.
That concludes our piece of the presentation. Any other questions?
No, actually, I just want to thank you. It was a very good presentation. It was very easy to understand and very easy to follow. And the font is big, which is good. So thank you for that.
Well, thank you. And we're excited to be working with the district and all of you moving forward.
If there's no more questions, do I have a motion? Okay, I have a motion by Mrs. Watts. Do I have a second?
Can we make sure the recommendation is clear, please?
Correct. What recommendation for what?
Oh, it says discussion and possible action.
But administration hasn't made a recommendation. They need to be clear.
Oh, okay. I'm sorry, Becky.
Administration does recommend approval.
Okay. Ms. Watts. Okay, Mrs. Watts makes the motion. Do I have a second?
Got a second?
Who seconded?
I did.
Reina? Okay, Mr. Reina, Mr. Castillo, Mr. Colonel,
In favor.
De Los Rios,
Favor.
Mr. Valdez. And I also vote in favor, motion carries. Going on to consent agenda. If there's no follow-up questions, board, do I have a motion to approve consent agenda as presented? Okay, I
Motion to approve.
have a motion by Mrs. Watts. David?
Second, I approve.
Okay, Mr. Castillo,
In favor.
Colonel, Mr. Valdez, Mr. Reina, and I also vote in favor, motion carries. Moving on down to item B, governance, conservator monthly report for June 2021. Mrs. Romero, you have the floor.
Yes, good evening, Madam President, members of the board, Ms. Castañeda, Superintendent Castañeda. Tonight I have the June meeting, and I hate to say this, but I mean, it's a whole month behind. So at the time, we had put in place Dr. Sorolla as acting superintendent on June 16. The district administrative offices were closed from June 28th through July the 16th, and the district hired a superintendent search consultant at the June 30th board meeting. This is under the governance. Then under the special accreditation investigation, on that one, since Dr. Sorolla was appointed as acting superintendent and the director of human resources vacancy was still existed, then he used the safety and risk supervisor to assist him with the human resources functions. Under the financial, you had just lost your assistant superintendent for business. And before she left, she went ahead and did a presentation on the budget that included salary increases for the staff. And you were also able to obtain the services, her services as a consultant, so that she would finish out the budget process and the setting of the tax rate. And on July 27th, the district hired the assistant superintendent for business. And then under the academics, on that instructional side of the district staff was working on the learning loss plan that is to be funded by your ESSER 3 funds, and emphasis is being placed on that, on the accelerated tutorials, professional development, instructional materials, and well-trained teachers. The plan is to be data-driven to provide the accelerated tutorials. That was submitted to TEA on July the 27th. And then one last item under the conservator's directives. The Human Resources Department is still looking for a software program that has gone out for bid, and it should be coming forward for board approval on the August 24th board meeting. Are there any questions?
Ms. Romero, actually, I don't have a question for you, but I guess I'm and maybe this is more for Dr. Sorolla. Dr. Sorolla, I know for about the five or 6 months in the past, I've been looking at a lot of things that are slightly off track or all under HR. Why is it that we still have like for example, the job descriptions, we're still having issues with updating our files to ensure that all staff certificates are valid. I mean, if you go in, that doesn't take very long to check, to look at current certifications. So I don't know why this has been ongoing on for about 6 months. And also the appraisals, why, I mean, I think about it, why are those, Ms. Castañeda, these items need to be fixed. They've been off track for too long. It is unacceptable, and we need to get them back on track. All these items under HR.
So to respond to your question, Dr. Valdez, I believe Ms. Romero's, I think in one of your recent reports, you did indicate that a lot of those items had been addressed, I think 2 months ago, right, Ms. Romero's? With regard to the job descriptions and the appraisals?
Right, but a lot of this is ongoing. I mean, it is constantly changing. As you're employing new staff, you are having to gather new data on everyone. So a lot of this changes.
That's correct. What I'm saying is that they've been off track for about 6 months. That is what is not acceptable. They should not be off track. I understand that they could be off track, but why aren't they resolved? They should be resolved, and we should get all of those things back on track, because I've been seeing it off track for a long time already. That's all I'm saying.
We would definitely work on that, Dr. Valdez.
And I will look into it also, but I will tell you the July meeting report already went in, so you will see it again in July, like that.
See, so that's going to make it 7 months already off track. That is what's concerning to me. And they're all from one department, Human Resources.
We'll continue to make it a priority to address those needs, Dr. Valdez.
Thank you. If there's no other questions, then we're going to go ahead and move on to executive session as authorized by Texas Government Code sections 55071, 072, 073, 074, 075, 076, 082, 083, and 084. Oh, the time is 21. I don't know if I set the time. The time is 9:43 and we are back in open session to take possible action on matters discussed in executive session. A, discussion and possible action to approve the superintendent's recommendation of personnel, approval of recommendation for professionals to include hiring and termination recommendation. Do I have a motion?
I move.
In the motion by Mrs. Watts,
A second.
second by Colonel Castillo,
In favor?
Mr. Del Rio is not here. Mr.
In favor.
And I also vote in favor, motion carries. Item number B, Mrs. Castañeda.
Administration recommends Mr. Gerardo Cavazos for Director of Finance.
Do you have a motion?
I move.
A motion by Mr. Castillo, second by Ms. Watts.
In favor.
Mr. Reyna.
In favor.
Also vote in favor, motion carries. Item C, the discussion of action to approve supplemental duty agreement of acting superintendent. Do I have a motion? Make a motion. Motion by Ms. Watts,
Second.
second by Colonel Castillo,
In favor?
and Mr. Reyna.
In favor.
And I also vote in favor, motion carries. Discussion of possible action regarding superintendent hiring process, no action. Do I have a motion to adjourn? Do I have a
Second.
Second by Colonel, Mr. Castillo,
In favor?
Mr. Reyna,
In favor.
and I also vote in favor, motion carries, meeting adjourned. Meeting adjourned.